Epilepsy is a disorder, an expression of storms that go unchecked in the brain. It may be some small area firing on its own, or it could be the whole brain. We continue to work on understanding why and how can we do better to control epilepsy.
Imad Najm will continue to persistently ask questions to make things better for his patients. The clarity, the commitment, the purpose that you can see in everything that he does.
When you look at how he has scaled epilepsy monitoring, and the field in general, it's unmatched.
His lifelong dedication to discovering why some seizures that couldn't be explained before, to understand what these are, now we call them focal cortical dysplasias. We have been able to treat patients that were considered to have incurable epilepsies less than 20 years ago.
I started working on focal cortical dysplasia when I was a fellow doing my training in epilepsy here. It's a journey that started almost 30 years ago. More than 90% of the brain neurons are formed within the first 3 months of gestation. Anything that can go wrong between these neurons dividing and migrating all the way to their final position, this is broadly called focal cortical dysplasia. I was interested in understanding the role of neurotransmitters and receptors. Could there be some changes in them making these dysmorphic dysplastic neurons epileptic? But we didn't have any classification for this. No order.
He convened in Cleveland a group of the international experts, and under his leadership developed a new way to classify these epilepsies. This is now the textbook standard for the world.
He has been studying areas of the brain that harbor focal cortical dysplasia, trying to understand at a molecular level what is leading to the seizures and what can be modified.
We found that this particular subunit of the NMDA receptor, it does increase during development of epilepsy. A medication that targets just this receptor that's creating epilepsy, but leaving alone everything else, could be a game changer.
This will open the door to taking care of different malformations of brain development beyond focal cortical dysplasia.
Imad is to epilepsy what Sones was to cardiology, because he has allowed us to see the disease that we couldn't see before, so that surgeons can treat them.
His impact already has been tremendous, and he isn't done. He continues to ask questions, leaving a legacy for our future colleagues.
Imad, what you have built will endure, but what is most important to remember is the commitment to the work that you have done and how much you have meant to all of us.